Welcome, everybody. It's September, and we are back to our town hall discussions on COVID-19. We took a break this summer or in August a little bit, but of course, COVID did not take a break. So we are back together again here, and we will take some of your questions and give you some updated information. As we enter into the fall, and it really feels like fall today, which is nice. So for our discussion today, we have several members of our executive leadership team with us. We have got Dr. Aaron Miller, who's our Director of Emergency Management, Dr. Ruben Varghese, our Director of Public Health, and Diane Kresh, who's our Director of the Arlington Public Library System. And we're really glad to have everybody with us. Thank you so much for being here. So at the moment, quick kind of brief update, and Dr. Varghese will do more in a little bit. We've kind of been hovering between the 4 and 5% positivity rate. And of course, we still have community spread of COVID-19. Over the last several weeks, we have added some testing capability. Starting this week, our Arlington Mill test location, which has been up and running, has expanded its hours. And that's to help us do a better job of reaching low-income and uninsured or underinsured residents. We also have held a couple of pop-up testing events in the Buckingham and Green Valley areas in the last couple of weeks, and that's been part of this Commonwealth's Health Equity Pilot. And we tested more than 230 people at those events, which are great. More pop-ups are planned in other areas, and we're kind of using the census data and our own health data to show where we think disproportionately there might be more COVID that we need to be testing for. We also, as probably most of you here today know, have tried some things. One of them we're rolling back, and that was our emergency physical distancing ordinance that we enacted in the end of July. That was to get people waiting outside some of our more popular bars and restaurants who tended to be congregating close together on the sidewalk, trying to get them to spread out more. But we found that the compliance really it wasn't as great as we'd hoped because of the new ordinance. Enforcement was challenging, so we're going to continue to work on these areas, but we are going to let that ordinance lapse. Our public health staff, along with the Arlington Restaurant Initiative staff, continue to educate our businesses and their clients on state regulations and guidelines, and doing everything we can to persuade people to comply with social distancing and, of course, wearing masks too when appropriate. Also, looking ahead to our restaurants, our staff are working on thinking about the fall, working on our temporary outdoor seating areas, the TOSA program. They are starting to work with restaurants to find some other ways that they can continue to operate outdoors in colder weather. And finally, we are continuing to ensure that we've got enough staffing for our contact tracing efforts, and I think we'll talk more about those later. And we, encourage folks, if you're interested, to please contact, if you'd like to volunteer, please go online to volunteer. And then anybody, of course, if you are contacted that you've maybe been exposed to COVID virus, that you will respond back. So, we've got some questions. I'm sure a lot coming in already, and Christian is here. And Christian, you and I haven't been together in this format for a while. And, I thought I'd just touch base because, the two of us are kind of different ends of the demographic spectrum. And I think we all are also have our own private personal lives, as everybody here does today. And we're all kind of coping with this. It's been about 7 months now. And, I was wondering how you were doing. I'm doing pretty well. I tend to sort of stay back in phase 1 in some ways as much as I can. I still don't go out a whole lot. I stay mostly at home. I did take a trip up to Maine, which was nice to get away for a little bit. I got myself tested ahead of time because the state of Maine requires you to have a COVID negative test before you enter the state. Went on an airplane, wearing a mask and wearing a face shield, and continue to wash my hands and stay separate. And we were outside a lot when we were there because it was great weather. So that was my little getaway. And it was nice to just get away for a little bit because I think this pandemic will be with us for a while. So how are you doing? Because you've got small children at home and school started. How's it going?
So, for the 190 days plus that we have been under really what is unprecedented in most everyone's lifetime, we're doing fine. School has started back for the kids, and they're being resilient and adjusting as many kids are able to do. We're fortunate to be able to generally follow the safer at home guidance, but certainly as we go out to get groceries and perform other important things, I am reminded of how much more challenging this is for many people in our community who don't have those options to perform their work via a virtual video conference live stream. And certainly as we look at our community, it's overwhelming how people have really been able to come together despite the enormous strain and toll that this is taking on individuals. And we just always appreciate those who are able to persevere through such challenging times to perform the work of staffing grocery stores and really making the economy and the community run to the extent that it is. So thanks to everybody for persevering through what has been 6+ months, over 190 days of incredible toil and strain. So let's get to it.
Yeah, I think we'll get to some questions, and thank you. Yeah, no, I felt incredibly lucky to be able to get away. I was just on Fort Myer base today, a socially distanced ceremony, actually thanking volunteers who continue to work. And volunteers are really kind of helping us hold it all together because these are extraordinary times, and it has been heartening. It's one of the silver linings of this whole pandemic is how people are stepping up and seeing that. It just is wonderful to see the community pulling together. So first question, I think it's been a while. Dr. Verghese, why don't you talk a little bit, give us a better update than I did kind of on where we are in the virus and what we're seeing.
Thank you, Ms. Garvey. In many ways, I think we have good news in that while we have community transmission of COVID still, compared to other parts of Virginia, we're actually lower than what's happening in those other parts of the state. And that's an important thing that we need to remember. We are actually collectively as a community and as a region staying home more and trying to reduce our interactions outside. So that's an important thing to remember. While we have cases, it's lower than other places. We've had adequate hospital capacity, but that doesn't mean we haven't had cases of COVID in Arlington. We still, as you mentioned, hover between 3% and 5% at the moment for the test positivity rate. And among our more vulnerable populations, it's a higher rate. And so it's why you have to remember we're doing these special interventions, trying to find individuals who may be more at risk for exposure to COVID so we can get them the support they need so that they can stay at home and not spread germs. It's going to be a long way to go because while we have adequate testing, we need the whole area and the whole nation to move in those directions. So I think we have good news in that people have been cooperating overall, and we have a long way to go because until there's a vaccine, we have to have that right balance between the activities to keep our economy going and trying to prevent public health spread of germs.
Thank you. We've had one question come in, which I think on face masks is fairly specific, but I thought maybe you could address it right now, as saying that our guidance on face coverings is not good, that we really ought to be using 2-layer fabric and mask, and that we should be specifying what people need to use, what kind of fabric and what kind of minimum density. Do you want to address that a little bit?
Sure. I'm not quite sure where they're getting that assessment because we link to the CDC page. And as a general rule, their guidance has been about doing at least 2-ply, if not 3-ply. There are, of course, questions about what would be better. We don't have a definitive answer to that from the CDC. So they've got guidance of what not to do. And so if anyone wants to send us material that we're happy to look at it, but we have to also make sure it's from a source that we believe is reputable and not just using common sense metrics at the like. So obviously the more layers, the better. We do know things like not having the vents would be better because it defeats the purpose of the vent. It may protect the individual, but the entire purpose is not to send more germs out to people, and a vent would just allow that to occur. So obviously staying at home still is important. And then when you're going out, wearing some sort of fabric over your face. If you're going to do a bandana, having several layers of it so that you have more layers to prevent germs from going out. People have put coffee filters in place. So all of those things are important things to do. The only thing that they have recently talked about are those neck gaiters, which look like what the runners will wear sometimes for cooling. There's some evidence that that may not be as effective to prevent germs from keeping them in. And in fact, it may actually aerosolize more. So CDC at this point has said that it should not be used as for masking purposes. You could wear a mask underneath it, and then if you need the cooling effects, that's a different discussion.
Great, thank you very much. And then as we went over, I think at our meeting, and you discussed, it's still staying 6 or more feet away from people is the best. So that's really good. Christian, we're getting a lot more questions. I'll let you take the next.
We've got a lot of questions, so
Yeah.
Why don't we get to them? And today we have the director of Arlington Public Libraries, Diane Kresh, who's here, and we've had a lot of questions about why libraries are offering a different service model than some of our other jurisdictions. So we wanted to invite Diane here to give an explanation of how she's assessed delivering library services during this time, and really all the other areas in which library staff have been repurposed and involved in supporting our county's pandemic response. So welcome, Diane.
Okay, thank you, Christian. Thank you, Libby. Thank you to my colleagues. It's a pleasure to join today. So I'm going to back up a little bit to give some context. When we closed in the middle of March because of the rise in cases in the area, the staff of the library was immediately deployed to another range of activities within the county. So, for example, we were supporting OEM, Aaron Miller's operation. We were supporting DTS. We got very involved in the cooperative for a hunger-free Arlington. So we were delivering meals. We were working with the nonprofits to make sure that no one in Arlington went hungry. And this was a cooperative. I know Libby knows a lot about it, and the board in general knows a lot about it, but I was privileged to work with Abby Raphael to work with AFAC and APS and DHS, again, to make sure that no one went hungry. And that was an effort that libraries supported through, I guess, late June. In addition, we've been answering telephones. We've been answering the main lines for the county. That work continues. And we have the honor of currently helping APS students get back to school, APS students signing up for Comcast Essentials, and we're doing PSAs for them, and we are doing nightly help desk, if you will, from 6 to 9, so make sure that the students and their families have the tools they need, and providing a lot of support to the comms program. So a lot of that work was what we immediately turned to, and then as we opened our own operation in mid-June, some of those people have been pulled back to focus on delivering, I think to date, I'm just going to look at my notes, more than 250,000 books have been delivered to the community at Central Library since we opened in mid-June. And that's a contact-free book delivery program, and I think both of you, maybe others of you, have experienced it. It took a lot of effort to stand it up because, again, the operative words are contact-free. Some things that people may not know, we have to quarantine books, for example, when they come back. They have to be quarantined for a minimum of 72 hours. So that also delays the ability to get books into the hands of readers. So the good news is Arlington loves its libraries, and the numbers speak for themselves. I haven't even talked about ebooks, but we're on track for 1 million circulations. And in a good year, that number hovers around 500,000. So I know that people are interested in what's next for the library, and the team and I have begun thinking about where to operationalize next, which branches, and at what level of service. Again, the two most operative words for us are safety and sustainability. Safety has to come first, so we have to observe all the protocols and make sure that social distancing is possible, both for the staff as well as the patrons. So to the point about other jurisdictions, we've all made decisions based on what we believe to be in the best interests of our community, based on patterns of use, what people are requesting. We determined early on that most of our patrons wanted books. We could certainly provide virtual programming. We could certainly do a lot of our author interviews and book clubs, but there's nothing like getting the book. And yes, ebooks are great, but I'm still old-fashioned and I like to read a print book. So that's where we put the emphasis. If you look at what Fairfax and Alexandria and other jurisdictions are doing, they're not fully open. They didn't fling open their doors and accept all comers. They have restrictions just like we do, restrictions in hours, restrictions in days of the week, restrictions in terms of what people can actually do. So I would prefer to say that we're operating in what we believe to be the best interest of Arlington Library users, and we will carry those principles, safety, sustainability, what's best in terms of what we can provide and what people are interested in, into our next phase of planning, which we've started now.
Thank you very much. I also want to just again thank you and the staff for how much you stepped up to help with the food distribution and working that out. You know, and not a lot of that is prioritizing. It's not that people working in libraries haven't been working. They've been sometimes working on some of the things that at the moment were really more important. And you're continuing to do those priorities, I think, as they need to be done. And we'll look forward to more library services. Arlington loves its libraries, which is wonderful. Yeah. Christian, I think we've gotten some questions about schools, but there was one on restaurants, on outdoor venues, and saying that they see lots of outdoor venues that are in violation of our TOSA, you know, the distancing and things. And why are they still open? And I wonder if maybe we could have, I'm not sure who it would be, if it would be Dr. Varghese perhaps, or perhaps Dr. Miller, talking about what we do to enforce the TOSAs and how that whole system kind of works with our restaurants. We also do have a hotline. If you see a place that seems to be in violation, you can call that hotline. I do forget the number, but I bet Dr. Varghese remembers. So
Sure.
Yeah, thank you, Dr. Varghese.
I'll be happy to tackle that. So I think in general, what happens with restaurants, it's something that public health has dealt with for years. We actually do restaurant inspections. The new part, though, is the parts of the executive order, including distancing. And so the staff have been working with the restaurants across the county to make sure that they understand what those things are. And we do take the complaints. They can come through the 799 number. There's also the app that's out there as well about any violations of various aspects of the governor's orders. And we go out and we try to primarily do it through education to get compliance. But tackling a question that's likely going to come up is, you know, what happens when they don't? We've actually hired people to be environmental health extenders, be part of our team so that they can go out nights and weekends, which typically our staff have not been able to do routinely, to be able to extend that reach so that we can actually see what's going on in the establishments which we have jurisdiction over and authority. So if we see violations on congregating within the restaurant, if employees of the restaurant are not wearing masks in customer-facing areas, that sort of thing, that we are first taking the education approach, but we'll cite them if it's egregious. And they know that at some point when we see a pattern in that particular establishment, we have, and I will take the suspension authority that we do have, although it will be actually a first-time untried situation for the whole Commonwealth. It's not new, or it's a new thing, and so we believe it'll work, but I want to ensure everyone understands our goal is to get people into compliance. The vast majority have been complying, and our staff are going out and looking to bring people into compliance, and we will take enforcement action when we see patterns to be able to then stand up in court if it has to go that far.
Thank you, Dr. Varghese, which kind of maybe gets us into the sidewalk ordinance. Christian, we've had a question on that. We had more than a few. Well, why don't you take it away? I was a bit on the losing side of that particular vote, and why don't you explain that a little bit, because it was a board vote on this one.
Well, just so everyone understands, we in July, instituted, or in August, instituted an emergency sidewalk ordinance to identify, or to really try and deal with an issue that we had identified, and that was gatherings of people that were significant and sustained for a period of time on our public spaces, places where we could actually control. And that was something where we saw, well, maybe there's an ordinance and an enforcement and education mechanism lever that we can pull to get people to exercise safe behavior when they're out and about patronizing restaurants. So we instituted the ordinance that was followed by a period of education. And then once education had been properly done throughout the area, police went out and tried to figure out how to actually apply the ordinance to the criminal citations that would be allowed under it. And after several weeks of doing that, what we found was generally the police were able to educate. They were able to distance people for a period of time. But then as the line moved and the lines evolved, compliance became spottier, and the situation of trying to discreetly identify offenders and pull them out and cite them with summonses became something that operationally they determined was just not practicable and feasible. So by letting the ordinance lapse, we're not saying that this is no longer an important thing to do. But like everything related to COVID, if we don't get people to buy in and comply, it's not going to work. Unfortunately, we cannot enforce our way to getting people to do what's necessary. We just don't have the resources to monitor every place at every time to make sure people are distancing on sidewalks or wearing face coverings when it's appropriate. So on some level, we have to figure out the secret balance of marrying forced compliance through enforcement versus encouraging and making people aware of what their responsibilities are to others and to themselves in getting us past this. And we're not always going to get it right, as is the case with the ordinance. We tried something, a majority of the board determined that it wasn't going to work. And here's the other principal thing. Since compliance is going to be a key part of this, we've got to make sure that we strike that fine balance between getting people to voluntarily do the right thing versus making them resistant to anything that we ask them to do. So we don't want people resisting wearing face coverings because the government's telling them to do it. We don't want people to resist distancing, physical distancing in public spaces because the government's telling them to do it, especially if we don't have the enforcement ability to make them. So that's the balance we're trying to strike. It's hard. We've spent a lot of time discussing it. The Sidewalk Ordinance is a classic case where we're going to continue to be out there telling people to do the right thing. And what we're going to need from everyone is to actually do it.
Thank you, Christian. And in many ways, it was interesting, the discussion we had at the board table. I think we all kind of agree what the situation was. And I was the odd board member out on that one, because I think what's going to continue is we're going to continue doing pretty much what we have been doing, which is trying to get voluntary compliance, because frankly, there's no way to ticket our way out of this. My concern was that by removing the ordinance and the threat of tickets and things, it made it seem a little less serious. But I don't think really effectively how it's going to be working is going to change. And obviously, if it starts to become much more of a problem and it seems that the ordinance really was helping, we will look at reinstating that or doing something else. We just, really have to keep kind of responding to the virus. Along these lines, Christian, we hear a lot. Bars are open, bars and restaurants are open, schools are closed. Which is a situation I don't think has any of us happy. And I think I might go to Dr. Varghese a little bit to talk about sort of, and it's fairly complex, but Dr. Varghese is totally up to it, what it takes to open schools. And you might talk about childcare. We've had a why aren't we offering childcare? We are working on that. But why don't you talk a little bit about what's involved in each, who has what authority, and whatever you think will be helpful for people to kind of understand the situation we're in. Thank you.
Sure. Thank you, Ms. Garvey. Happy to address that. So I think people need to realize that the governor's executive orders only go so far, and some of it's public health oriented and some of it's practical to try to open up the economy. So one of the things that I think talked in this forum before, initially when there were the complete phase 0 stay-at-home orders, really non-essential movement out of the house was really restricted. Then we went to phase 1 where 10 people were allowed to gather, phase 2, 50 people or less. and now we're in phase 3, 250 people and less, and schools are something that can open. At the same time, you have to be able to also try to maintain 6-foot distances in those sorts of settings. And so one of the challenges that schools have, and they have the complete authority. The bars are not under schools' authority. Bars can open up under the governor's orders. And so we can't restrict that sort of activity, but we're trying through other means to get them into compliance. But the schools have to make the decision about when they believe it's safe to open. It's not necessarily just being based on a public health determination. In fact, public health works with the schools. We inform them of the situation, but just like with a doctor, I'm not going to tell you as the county board what specifically to do as much as what are the options, because in a sense, I'm not elected to make the decision as the chemotherapy, radiation, immunotherapy for a cancer, which of the options do people want to take? Because that's going to be a community decision, not just one person's decision. Likewise, the school board and the superintendent have to make decisions about not only what's going on to make sure their environment is safe and healthy for the students and for the teachers and the other staff in the schools. They also have to figure out the operational considerations on how to actually make something like this happen. How do they clean and disinfect schools appropriately? Can they maintain 6-foot distances in the schools to reduce the transmission? Because that's still our recommendation. They don't have to, but can you imagine if you're concerned as an Arlington parent for the safety of your students? Some will want 6-foot distances, others may be more comfortable with something less. They've got a lot of decisions to have to figure out how to put that together, and it is not Arlington Public Health that's telling them to open or close. They've got the authority now. However, I think they're being very thoughtful about how to do it safely and to achieve the goal of getting as much in-person time as possible without actually compromising health, which is not an easy thing to do.
Thank
and
you.
if we can continue with the discussion on schools, many people are wondering what is happening to support APS during this period of virtual learning, and really what's the relationship like between APS and the county as we deal with these real important issues for families. So just a few things, and anyone else feel free to fill in when necessary. So when APS made the decision to go all virtual, there was the immediate question of whether or not that was going to work for every family. So fortunately, APS already had a device plan in place to make sure every student had an APS device to use. But then, of course, no device is useful unless it's got connectivity. So there was the effort where the county provided APS with the resources to partner with Comcast to wire everyone with an essential level of service for broadband for people for whom that would work. We then discovered that that wasn't going to work for everyone, so that there were the deployment of essentially Wi-Fi hotspots for families who were in a situation where the wired connection couldn't work. And then we realized there were still gaps. So the county has been working to install essentially Wi-Fi blasters, which will connect people to the APS network for virtual learning. We don't expect that that is going to meet the need of every single child, because it's not just about the device. It's not just about connectivity. It's about whether or not the family has a home situation set up where each child can have a discrete learning space. It's also about whether or not there's the quality of Wi-Fi throughout the home, which may allow everyone to participate in synchronous learning. So we know that there is a real need to stand up some way for parents to get a combination of childcare and virtual learning supports, someplace where their child can be that's going to be safe, supervised, where they can do their schooling if the home environment doesn't allow for them to be connected and supervised at home. So we are actively working with APS to figure out how we can do that. We're going to need to use school facilities, and we're going to need to use staff who were previously working in extended day to make this work due to complex bureaucratic reasons of licensing, but we are actively trying to do that. Similarly, there are other organizations in the community who likewise want to fill that void. And we are working to clear through all the bureaucratic red tape and licensing to make sure anyone who wants to serve that real need for families in our community can do so. I am, like many people, disappointed that we haven't gotten there yet, but know that it is something that we are working on multiple fronts to achieve very soon.
Thank you, Christian. I think that if people get the idea that we're trying sort of everything, that's correct. And different, there's no one silver bullet that's going to fix the whole situation for schools or for childcare. And we really are trying everything. I think, we are looking at opening a couple of our community centers for children to have supervised learning when their parents have to be working. I know the school system, and we too are interested in is trying to get students back or get students into childcare that need it. We're trying to do it in a priority order for those who are kind of most at risk and having the toughest time with the current situation. The internet has continued to be a frustration, but we are doing everything we can, and we're making progress. It's just far slower than any of us would like.
Libby,
Diane, I see you. I see you there. Yes.
Right. I just want to add to what the two of you have said. The Department of Technology Services, Jack Belcher and his team, have been working with libraries and others, including DHS and APS, to add more Wi-Fi hotspots. When we augmented the Wi-Fi capability at Aurora Hills Library this summer in the parking lot, we saw a dramatic increase in the ability of people in that community to use the internet. I already mentioned that we're helping APS students and their families with Comcast Essentials, doing some evening training. But I think this is something that I want to just reinforce, that we are well aware that there are many of our communities still in need, and we're trying to do just whatever we can on both a small scale as well as a larger scale basis to make sure that no one goes without.
Yeah, thank you, Diane. Thank you for everything you're doing. And I don't know, Christian, we do meet. We have a leadership meeting once a month, or sometimes twice a month, with the school board chair and vice chair, the superintendent, and the manager to hash through issues. And it's interesting, even in those meetings, we'll come up with something that we said, oh, well, we could do this and this and this, and we actually do continue to make progress. We are trying very hard to keep the lines of communication open. And I will be at the kickoff County Council PTAs meeting to try and help answer questions from our PTAs along with the chair of the school board. And, Christian, one of the questions that came in, which I sort of addressed, but maybe it's come in again, as on testing. And I wonder if we might give Dr. Varghese a break and ask Dr. Miller to talk about the pop-up testing. I mean, if somebody wants to get tested, what do they do? And I will say, for example, I should have easily known, and I needed this test and I wasn't sure what to do. It turned out that my health provider, Kaiser, I just had to talk to my doctor, explain the situation, and I had a test within 24 hours. So there is a lot out there, but it's again a lot of different things to fit people's needs. So, Dr. Miller, do you want to just talk a little bit about what we're doing and what we're off?
Sure. Thank you. So to your point about there being a lot of different resources and availability, I will say that this is something that you as a board have highlighted time and time again, is that the lack of a coherent national strategy, how that rolls down and really impacts us at the local level. And this is something we're seeing. For those individuals that have access to healthcare providers, the Commonwealth of Virginia, the testing strategy as well as the protocols which govern it are set by the Commissioner of Health at the state level, and part of the governor's team that decides that policy. So across the Commonwealth, it is still a requirement that you have a doctor's order or physician's referral in order to get tested. Now, there are certain exceptions to that, and we can post a link to the VDH testing priority webpage, which was just updated about 4 days ago, actually. And those exceptions are for certain public health surveillance testing. So, for instance, in a long-term care facility, such as a nursing home or a hospital, where we do what's called a point prevalence survey. And also for community testing events. And those community testing events are what we are holding as some of those pop-ups. So, as you mentioned, several different avenues. So I'll sort of go a little bit into them and then Dr. Varghese can chime in. So if you have access to a primary care physician, if you have health insurance, just like you contacted Kaiser, we're encouraging folks to reach out to their healthcare provider. The discussion about your individual healthcare needs, your comorbidities, your risks and exposures is best left to you and your healthcare provider, so that they can make informed decisions, as Dr. Varghese was saying, to help you determine your need for testing. Many are available through telehealth, for example, and a lot of our hospitals or walk-in clinics or doctor's offices have now been able to offer that. If you do not have access to a primary healthcare provider, the county is working with the Arlington Free Clinic to establish not only linkages to the healthcare system, but also linkages to testing. Because it's one thing to get tested, but it's another thing to have the healthcare system support and wraparound services that can assist you if, in fact, you do have a positive test. So things like assistance in how to quarantine and isolate, resources to connect you with the Department of Human Services through rental assistance, food assistance, and other items. I see a bunch of questions coming in asking about if doctors will give referrals for testing due to travel. That's all going to be dependent. But we also have within our coronavirus webpage a map and listing of all testing locations within the region. And so you'll be able to find out different protocols for each one of those. So I use Preston's Pharmacy as an example, right? Within our community, a place where you can schedule online easily for both a diagnostic test, but also an antigen test, where you can receive referral services and testing together. Some pharmacies, CVS and Walgreens, for example, have those within the region. So Dr. Varghese, I'll turn it over to you to wrap that up nicely for us.
Well, that was a tremendous summary. I just wanted to add a couple of things. There are also home-based tests that can happen that you can have mailed in. For example, LabCorp has that sort of system. And before they send it to you, they do some screening questions to see if you would qualify. Not everything has to be symptom-based, and they actually do have medical providers that are authorizing that. So there are actually more options out there. I think people are maybe conflating a couple of issues. You can get testing done often and find providers, and most of the time the insurance company will pay for it, but there's not necessarily a guarantee those two things will necessarily happen. And so I want to make sure people aren't, I'll deliver the bad news, it's like if they're looking for a free test, that may be a little bit less likely depending on the circumstance, but the ability to get the testing done, there are multiple opportunities, and not everyone's doing it strictly on symptoms, but that's going to be between the provider and who's doing the actual testing. I've personally done a couple of the home-based tests for my travel purposes, and some of it will be covered by insurance and some of it will not.
What about the turnaround time on getting the results?
So the turnaround time, unless you have a rapid test in, say, a facility that you're going to, say, an urgent care center, there are some places where you can get results in 15 minutes. That's not the norm. However, those places are out there in the region. We don't have a list. We're trying to come up with as much of that as possible to let people know. But the turnaround time is anywhere between 3 and 5 days ideally, but it depends on which company you're using and how much they're actually getting hit with at that moment. I think I did see in the chat box, there's like, well, if you don't get the test within a day, the result, it's useless. That's actually not true. What we have to remind people of is if you believe or your doctor believes you have COVID, my public health advice, and we've been saying this across the nation, is you treat it as if you have COVID. You don't wait for a test result to necessarily say whether you have COVID or not. And in fact, a negative test does not necessarily mean you don't have COVID. All it means is on that day that you were tested, you were not able to detect COVID. If your doctor and you, with your symptoms, believe that it's consistent with COVID, you treat it as if it's COVID. So we have to dispel that sort of myth that if you don't get it in time, you can't actually take action. A lot of people in Arlington and across the nation have been voluntarily compliant because they know it'll help themselves and help prevent the spread of germs in Arlington by treating things as if they are COVID.
Thank you. Thank you, Dr. Verghese and Dr. Miller. Christian, I'm going to turn it over to you, but I think I'll just say, if in listening to this, it sounds kind of like a crazy quilt of how we're handling testing and how we're handling a lot of things, and people can correct me who are here with our team, but some of this is a result of the fact that we have no national policy and guidance, and even the state as a whole has been not really great about stepping up. In other places in the world and other states, sometimes you've really got a full bore top level government stepping up and coming up with some blanket methods and support. But we've kind of been a lot on our own and piecing things together as best we can. I think it's gotten better and better. I think we keep getting closer and closer to anyone in Arlington being able to quickly have a rapid test that can get the results back quickly and that is easy to do. But we're not there yet. We are working towards it. But it's hard to be doing this as one little county in the middle of a global pandemic. Dr. Verghese, you came on again, so I figured,
Sure.
Did you have something more to say?
Well, I think that's an important thing that we have to remind people is we are culturally different than a number of other places in the world where it looks like it's been successful. If you don't have a national strategy and collectively can get the majority of the population to buy into things like agreeing to testing on a routine basis, having put in the resources to have that sort of testing and so on, it is a crazy quilt in some ways. And you can do the best you can in Arlington, but as I've said, geographic borders don't really, or germs don't respect geographic borders. And so we can do the best we can in Arlington, but unless we're literally in a hermetically sealed bubble for Arlington and don't allow people in or out, what happens outside of Arlington actually has a direct impact on how we recover as well. And so this reminds us of the interconnectedness of our world, which overall is a positive thing. However, you have to get a lot more people to buy in than just Arlingtonians.
Yeah, thank you. Yeah, a lot of times people want to, why don't you just do such and such, but there's a limit to our authority and we are tied in with everybody else. Christian, over to you.
So, and just to put a finer point on testing and our previous conversation about schools, so there are people who are wondering if rapid saliva tests, a rapid test would be a solution for schools to reopening. And certainly that would help, I would presume, but that is not the only decision lever, as we understand it, that the schools are using to make in terms of when they should return and whether they should prioritize certain students over the others. They are making those decisions based on a number of factors, including staffing availability, as well as determining who might be sick and who might be virus carriers. So if Dr. Verghese just wants to put a finer point that there's really not one particular thing that is lacking from a community response standpoint that is preventing schools from reopening.
Sure. Well, once again, well stated, and they are considering more than just COVID, the level of COVID activity in the community, although that's a very important thing, as I understand that they're considering. Having said that, testing is going to be critical, and we've actually connected the school system to potential testing resources. But testing does not solve some of the other questions they have to come up with, things like 6-foot distances and so on. If that's the current recommendation, which it is from public health, not just here in Arlington, but by VDH and others, that's the preferred sort of system. You have to make sure you can achieve that or explain to parents how you're putting in other measures to reduce the risk. And so that's one of the things that it's a delicate balance for even a resource-rich community like Arlington. You know, our schools are our schools. They were designed pre-COVID. You don't normally have classrooms that normally can have 6-foot distances and have the same number of children. If 20 was the number, most of our classrooms still don't have that room. They've got to figure out how to make that work or reduce the risk if they're doing something other than 6-foot distances. And it's not just Arlington, others have to do that as well. So I think the saliva testing is obviously a good option if we can get a rapid version of it. We've been promoting a saliva-based test that isn't a rapid test, but it reduces the amount of PPE necessary. It reduces one less barrier, was something that Dr. Miller and his team has been really spearheading for us, so that we at least reduce one barrier, that we don't have to rely on as much extensive personal protective equipment. So to what Ms. Garvey and you had said earlier, Mr. Dorsey, we're trying to tackle this in multiple ways, but it's going to be taking a multi-pronged approach, and it's going to be an evolutionary approach, because resources and knowledge about this crisis keeps evolving.
You know, Christian, I wonder if we might follow up on antibody testing. We had one question on that. If Dr. Verghese, I'm so sorry, we'll give you a break soon, I hope. People are asking about antibody testing. Would you talk about how useful antibody testing is? Because I believe it's the testing for the presence of the COVID virus that's much more helpful than knowing that somebody has had it.
Correct. So antibody testing, as you said, is literally, it's like where you had some prior exposure. It does not talk about current exposure. And if I have to choose, I'm going to still always go with some sort of detection of the virus from saliva or from the nose as the primary activity to know whether there's infection or not. The antibody, I think people are looking for that it will say long-term immunity, and we actually don't have any evidence that one exposure to coronavirus after you go through it, that you have lifelong immunity. And in fact, there's more and more case reports of individuals after 90 days looking like they may have a second infection. No one's come out saying that it's definite yet, but they're pulling those pieces together because they have not been willing to say there's lifelong immunity. And so that is why we really need to look at the PCR test looking for the virus rather than blood draws on antibodies to wonder whether or not you've had past infection. It doesn't give us any confidence about future risk and the ability to let students or workers come back to the office and not be still at risk for another infection.
Thank you. Christian.
So schools are clearly a big issue, and we're going to make sure that we go through and capture any points that have not been addressed thus far. But while we're doing that, why don't we get at some of the other issues that are on people's minds that might be easier to deal with? So today is the first day that people can vote in person, and demand seems to be quite high. There's some questions about when and how people can vote. You can vote today now by showing up at Courthouse Plaza, 2200 Clarendon Boulevard. If you remember, there used to be a Wells Fargo Bank fronting the central portion of Courthouse Plaza. That is where you can do in-person early voting right now, if you so desire. And over the course of the next 60 days, there will be a variety of opportunities for people to use to exercise their right to vote, including requesting a mail-in ballot. And then also there will be a number of satellite locations that will be stood up in addition to the one at Courthouse Plaza. Those begin, I believe, October 17th. Those will be available for the last 2+ weeks of the election. There will be drop boxes available at Courthouse Plaza as well as other satellite voting locations. And we're looking for other places to securely and prominently locate a drop-off mailbox. Too much information to relay in the town hall. Go to vote.arlingtonva.us, where all of that information is chronicled. But I know that there's a lot of excitement about people participating in the November elections.
Absolutely. And I just want to urge people, I think absentee is a great way to vote. I've ordered my absentee ballot, but I'm not planning to mail it back in. And my plan right now is to take it and put it in one of those drop boxes so that I know that it's arrived, so that I don't have to worry about whether the mail has gotten it there or not. So, people need to do what is comfortable for them, but there are a lot of possibilities. And I'm sure if you don't remember all these addresses, just go online and say, how do I vote in Arlington County, Virginia? And I bet it'll pop up. There are a lot of ways. Thank you, Christian.
We did get a question about one of the things that we tried to do to make going through daily life a little safer, contactless crossing of our streets and roads through automated pedestrian signals. And there's someone whose observation is that those are not really working so well, given that they create the unintended consequence of having cars idle unnecessarily when pedestrians are not present. And whether or not we can take a look at that and seeing whether or not the benefits of contactless approaches to an intersection outweigh the environmental issues of idling. So we'll be sure to take that to our Department of Environmental Services team so that they can take a look at it.
We also got a question about, are we ready to go to slightly different
Please.
topic, if
Yep.
that's all right? We also got a question actually on tax. You know, this is a hard time for people to come up with the money for taxes. I think somebody was asking, could we decouple your car property tax with your real estate tax? They're both right now due at the same time, which can be a big financial lift, and it might help people to spread them out. And we will look into that. Absolutely. And then, you know, we've got Deputy Manager Jim Schwartz has joined us. I've got a question I think is maybe for him, and I thought I would throw that one out to give both of our doctors a little bit of a break. And this one, Jim, we got a question on multi-units, which we hear a lot. So there are people inside common areas, and we have our "We Are Covered" sticker on the building, and that says that they're inside there. You've got to wear a mask, you've got to distance. But in some of our multifamily buildings, there are lots and lots of them, and that sign is not on those. And people are upset about folks within the building not doing what they need to do. Do you want to talk a little bit more about what we're trying to do to support multi-unit buildings and to try to get folks in there to do what they need to do with wearing face coverings and distancing?
Yeah, absolutely, Madam Chair. And this, you know, obviously is a point of frustration for a lot of people because this is not the first time we've gotten that question in these town halls. I'd have to guess we've probably seen a question like this more than a half a dozen times over the course of these gatherings. And, you know, we're limited in what we can do beyond encouragement. Perhaps we need to look at some more outreach to some of those facilities. It's interesting that in this particular example, the apartment management is willing to put the sign on the door, presumably to their office, that would protect the workers in that office, but not necessarily extending that same messaging to the buildings that I see characterized in the question. So a lot of this does come back to our outreach, which we obviously could do a little bit more of. And then it goes to people just being aware of their circumstances, their surroundings, and taking the kinds of precautions. I think we've mentioned this before, that if people are leaving their apartments and they have close quarters by way of the hallways and such, you know, if they're putting on their face covering, that's great. They should then be looking to see, you know, where other people might be within the building, where other people are traveling within the building on the way to elevators and such, you know, before they venture any further. So we understand it's, you know, we're doing everything by way of messaging for social distancing. There are some circumstances like apartment buildings where the crowding and just the number of people that are, you know, co-located in one particular place makes it a little bit more difficult. So let me leave it there, but, you know, let us also, we'll take that back and see if there's maybe more about the way that we can do public messaging, just to see if we can encourage apartment managements to, you know, enlist their support and help us with that messaging.
Thank you, Mr. Schwartz. You know, I want to just knock off a quick one real quick, Christian, and back over to you. We did get a question about what are we doing about budget shortfalls that are hampering schools from reopening? And I just say there is my understanding that schools not opening has nothing to do with budget shortfalls right now. And we are going to do everything we can to make sure that schools open and to support the schools as we can to reopen. And it's not a shortage of money right now. It's all the realities of this virus and how it works and spreads among children, people, and inside buildings. Christian, over to you.
Yeah, on a real-time basis, we're in conversation with schools about their budget outlook. And as you can imagine, we at the county also are looking at our long-term budget outlook. While there's nothing specific to share at this point, we're going to be challenged in the year ahead, but that's not impacting schools reopening. And certainly as schools have had to undergo expenses to prepare for the pandemic, a number of added expenses. There's been a commitment on funds from the county to meet those expenses and ongoing partnership to figure out how to resolve the budget issues moving forward. Similarly, there have been some questions about whether or not the county would commit park space to support schools in any reopening plans. You know, the short answer is yes. We've been working with them for a long time to identify the feasibility of, you know, using all-season tents to expand the availability of instructional space. We've also had a recent approval of something sponsored by the Roslyn Business Improvement District to use Gateway Park and provide a sort of multi-season, a 3-season opportunity for people to do both office work, or it could also work for virtual learning, where there will be areas set up where people can have tables, they can plug in their devices. Now, that's not providing the supervision aspect of it, but again, if there's a desire for people to do the virtual learning and have outdoor facilities that are connected to do it, we're trying to be as creative as possible to meet all of those ideas and desires.
So, I'm seeing one that's kind of related. It's not quite as serious an issue as schools for children or as childcare. Halloween. It is something a bit of a, it's a tradition. It's nice for the kids to get outside and be in their neighborhood. Dr. Verghese, could you talk a little bit about whether Halloween should happen somewhat the way it usually does, and how we could do that safely if it's possible?
Sure. The best way I can address it right now is we are waiting for guidance from CDC and the Virginia Department of Health. We understand that both organizations are closer to putting out guidance next week. With that caveat, obviously, I'm going to still beat the same drum: 6-foot distances. And obviously, people should not be trick-or-treating if there's any symptoms at all. Those are going to be some of the things that parents are still going to have to think about. And I realize it's an important cultural activity, and my own little subsection of Fairlington clears out its parking lot typically, and we all sit outside looking forward to the kids coming by and providing candy. So we are waiting for that guidance, and so that's the best I would say right now. I think there are ways to do it, but it's going to probably be on a more limited scale, and making sure that people, what's important, is it the candy or is it the costuming? I think you can have a lot of fun with the costuming, and are there ways that we can actually let kids be who they are and wear costumes? That would be my bent, but I want to see what the recommendations are.
Thank you. Well, I think we probably have one more town hall at least before we get several before town hall, so we be prepared for more questions on that one. Christian, do we want to touch real quickly on the Purple Lounge issue?
Go right ahead.
We had a question. So that was an ABC settlement. Let's see, ABC Alcohol and Beverage Commission, I think. Alcohol Beverage
Control.
Thank you. Thank you. And they had it was a legal settlement. We had no part in that. We were disappointed that there was not an absolute revocation of the license for the Purple Lounge. This is a bar, restaurant, but mostly a bar on Columbia Pike that has been associated with a lot of very serious incidences, and we really don't want those kind of we don't want those kind of things happening in Arlington, and this particular establishment seems to be a magnet for it. I thought what I would do is ask our staff to put in the chat here and online a link to the press release, which I think explains the settlement, the restrictions that ABC did put on it, and our absolute commitment to make sure all of those restrictions are followed really tightly. We will be keeping a very close watch. This is, again, one of those authority things. We're very limited in our authority. ABC has the authority on the liquor license. We're going to do everything we can to make sure we enforce it absolutely as strictly as we can. And we make sure that what's been happening there stops. I don't know if you want to add anything, but I think probably reading the press release, which has a lot of details, might be helpful for folks.
Yeah, thank you. Thank you. I think that says it well. So a couple of more questions. So Dr. Verghese, I don't know if you've thought about this yet, but apparently there have been some questions that we've been receiving about Halloween and any public health guidance for that holiday.
We just covered that one.
Oh, I'm sorry. Yeah. I missed it.
No, that's
apologize.
Okay. That's all right. We've got a lot going on.
Must have been a break.
Yep. No, that's fine.
So Libby, as I go through the questions, I think the only key area that we haven't touched on at all is, nope, we did that as well. Just a little word about evictions. So there's been a concerted effort to not add to the fundamental trauma that COVID has brought on many people by having them displaced from their homes. And certainly that wouldn't be good for public health as well. There have been efforts to delay judicial action on evictions, but anyone who has been involved in this issue knows that that doesn't solve the underlying issue. The underlying issue is that people don't have the income to stay current on rent. And regardless of when you stay the date of a potential eviction, if you don't solve that underlying issue, then you have not, provided the help necessary for that family. There have been thus far over $3 million in relief that has been provided for people to deal with the underlying issue of evictions. And as we work through with our various community partners, as well as our Department of Human Services, that's very much where we are focused, trying to make sure that we can get people, current, regardless of their income situation, so that we deal with the underlying concern behind evictions. Any more to add to that, Libby?
No, I just think we're doing everything we can to make sure that we don't have people a lot more homeless people on the streets who are hungry. I mean, we're trying to make sure people have shelter and food, and that is important for everyone during this pandemic, as it is always, and we're really doing everything we can to make sure that that doesn't happen. And we appreciate, actually, I think we should, a big shout out to our nonprofit partners who are able sometimes to be more flexible than we are, and they've been good partners with them. We support them financially and in other ways, and together, I think, managing to, again, it's another patchwork, right? Because that's what we're faced with when you don't have a real good national policy on something or a good state policy, but we're doing everything we can. Christian, we're up on the a little past 1:30. I don't know if I might invite and I think we've covered most of the question areas, I believe.
We have.
I think we have. So I just first see if Dr. Verghese, Dr. Miller, or Mr. Schwartz, or Diane Kresh, anybody has something that they want to add to what for people to know, and then maybe we'll just make a few concluding remarks. And don't volunteer all at once.
No, thank you, Libby. This is Diane. I'm fine. Thank you for the opportunity today. It was really important to get the message out.
Thank you. Thanks for all you're doing. Dr. Verghese.
Nothing from me,
Okay.
Madam Chair.
Nope. That's fine. That's fine. Christian, some concluding remarks at all?
Well, certainly, I think this town hall has revealed that, while there's been some progress and some positive things that have happened, there's still many areas in which we are trying to work diligently in order to improve outcomes and circumstances, and none more important than schools and what happens with our children, both in having this virtual learning experiment be productive and fruitful, but also, as is my desire as a parent, to get our kids back to school as quickly as is practicable. Realize that a lot of people are not satisfied that some of their questions about school reopening plans we couldn't address, simply because it's not our area of primary responsibility. But rest assured, we're not abdicating being concerned about it. We're in constant contact with APS and its leadership and its superintendent to really figure out how we get this done, because we recognize this is incredibly important for Arlington families. And, I recognize that it's frustrating to see that so much of life we've worked to bring back to some semblance of normality. And then with schools, this is something that continues to be a great burden for a great many. So I understand that, realize it's not satisfying, and hopefully you can accept that we are working to try and produce a result that does work for most people. And I'll just say it's been good to be back with you, Libby, and to be able to inform the community at least on what's going on. And to all of our Jewish members of our community, Shana Tova, Happy New Year.
Yep. Happy New Year to everybody. Indeed, this does feel like the start of the year in many ways. Thank you, Christian. Thank you, everybody, for being here. And I want to thank our community again. I mean, I know people are frustrated, anxious, upset at times and stuff, but people have really been understanding, mostly stepping up to help their neighbors, complying, wearing the face mask, even when it's not really much fun to do so, quarantining or isolating themselves a lot of the time. we're getting through it. It's not as smooth or as well as we'd like, but given everything that's coming our way, I think we're doing okay, and we will continue to work on it. We'll continue to hold these town halls. I will toss out for folks listening, if you've got some ideas for some other town hall issues besides focusing just on COVID, we would welcome those. I suspect as we get into October and certainly November, we might touch on budget issues because our budget, obviously it's connected with COVID, but we've got a lot of probably some major changes and issues coming up. So I think I'll finish with that, just urging everybody continue. It's been going on a long time, but we still, as what's clear, the best thing you can do is wear the face coverings, stay 6 feet apart, and try not to get out in crowds any more than you have to. And we will get back to life as normal, our new normal, whatever that is, but it's going to take a while longer. And thank you all for your patience and everybody for what you're doing. So I think with that, we will say goodbye, and we'll be back. Two of our other colleagues will be back here, I think, in 2 weeks with another town hall. People can send in their questions. We try to answer them. Obviously, emails are welcome at any time, and we do try to answer everything. All right. I think with that, we're finished for this town hall. Thank you all very much. Everybody stay well. Have a good weekend. And Happy New Year for those who celebrate Rosh Hashanah, and for everybody else, Happy New Year too. Thanks a lot. Take care.
Thank you.
Yeah, take care.